Good morning, everyone.
Hi,
Hi.
everyone.
My name is Sarah Kelly Palmer.
And I'm Kayla David.
Welcome to Be Well Live. For those of you who are with us for the first time, Kayla and I work for Family Service of Rhode Island in the healing department, and we gather together every other week to talk about various topics related how we're all coping with the COVID-19 crisis. Family Service of Rhode Island is a social service agency and we've been serving Rhode Islanders for over 125 years. We offer a wide variety of services, including telehealth counseling.
That's right, Sarah. We'll be joining together today and every other Wednesday at 10 a.m. for discussions that support wellness during COVID-19. So we ask that you please take a moment to share this with your friends or to start a watch party. We are on Facebook and we're also on YouTube. So please help us reach as many as we can to share important information about being well during COVID-19. Now more than ever, it's important for us to be able to reach out if we're struggling and to help our loved ones be able to connect with assistances if they're struggling. COVID-19 has put a great deal of stress on all of us in so many ways, and that's impacting our overall well-being as well as our mental health.
You're so right, Kayla. Our hearts really go out to all who have been infected and impacted by COVID-19, and for everyone's lives who've been disrupted by this pandemic, which really is everyone, right? We know that COVID cases are on the rise right now nationally, but also locally here in Rhode Island. And we're particularly concerned about the significant impacts that this public health crisis is likely to have on our communities, on children, on families, um, right here in our local communities. We know that our governor has implemented increased restrictions for things like the number of people you can have gathering. She's asking us, to stay home during the holidays. And I think with the increasing numbers and all that we're hearing, many of us are worried about what the future holds. We do know, however, that there are ways that individually, as families, as communities, we can keep ourselves, our families, and friends safe. And we really all can contribute to stopping the spread of COVID-19.
Yeah, and today we have a very special guest here to talk to us about how we can contribute to stopping the spread of COVID-19. We have Alan Mendez. Welcome, Alan.
Hi, everybody. Hi, guys. Thanks for
Hi,
having me.
Alan.
So Alan's here from the COVID response team at Family Service of Rhode Island to talk to us about how we can keep ourselves, our families, and our communities safe.
We're so happy to have you on with us this morning, Alan.
Well,
Thank
thank
you
so
for
much for having
joining
me. I
us.
really appreciate it.
Why don't we start off by you telling us a little bit about the COVID response program that you work in at Family Service?
Yeah, absolutely. So I am a community health worker, specifically with the FSRI's COVID-19 emergency response team. We belong to the community health team, and which is part of the health department. And specifically, what we are doing, we're a small team that is going out into the community and basically just connecting the people in the hotspots with resources and services that they need to kind of just stay safe during COVID-19. We are basically part of something called the Health Equity Zone.
Okay.
And different organizations like FSRI are assigned to different parts of the city and the state to kind of focus in on that one area. So Family Service of Rhode Island is assigned to 02905, which is about Lower South Providence, Cranston area. And so basically what we do is, we try to go out there, connect with stakeholders in that area, churches, libraries, places that people frequently gather, or people that, kind of know the community and they trust them. We go out there, we try to connect with them, hey, are there families or people you've identified that could really need help, or they've come to you and they said, hey, I don't have anything to eat. I can't pay my rent, things like that. We try to reach out to those people and connect them to the resources that we can.
Excellent, Alan. That's so amazing. And it's so nice to know that you're in, locally right in the 02905, which I know has been having, has had a significant rise in cases. And
Absolutely. Yeah.
are there any trends that you're seeing in kind of our communities here in Rhode Island that are concerning related to COVID-19?
Yeah, well, there's a few. Well, we've noticed that there is a huge spike. I mean, you guys know that there's a huge spike in cases pretty much everywhere, specifically here in the city. I think that might be due to, us living in so much closer quarters compared to more rural areas. But yeah, there's been a huge spike, and particularly in places like Lower South Providence. And it might be due to a few things. A lot of people still have to go about their day to day. A lot of people, we've seen that can't quarantine, can't isolate, and they're still going out and about. And, that's no fault of their own a lot of the times, but we are seeing a huge spike in cases across all demographics. The needs have been the same for a while. It's usually need for food and need for housing assistance. A lot of people are finding it harder to get access to food and harder to meet their rent. And a lot of people, now utilities is becoming an issue too. People are saying, they're 2, 3, 4 months behind on the utilities, 5, 6 months behind on their rent. And so that's concerning, I think, because it's expected that in January, there's going to be another pandemic, and that is the flood of evictions, which
Right.
is very worrisome, because a lot of people, their home is, for everyone, your home is, that's everything. And so to lose your home, that's pretty hard. And so that's really been the main issue. Getting people housing has been tough.
Yeah, and I think, Alan, we know that this pandemic is not only impacting, people's physical health, their kind of social and emotional well-being, but financially, just as you kind of highlighted, this has had such a negative impact on so many Rhode Islanders
Oh
and so
yeah.
many
Yeah.
people. So, and as you're saying, people going about their day to day, people, right, if they want to continue to support their families, they are still going out to work and they're trying to make a living. So I think for many families and many people, it can be hard to know, you know, how can I keep my family safe as cases rise? If I still have to go, if I'm still reporting to work and maybe that work that I'm doing, maybe I'm a healthcare worker, or maybe I'm, working at a grocery store or places where a
Yeah.
lot of people are in and out and that exposure goes up.
Mhm.
What are some ways that people can work to keep themselves and their families safe as we're seeing cases rise?
Yeah, well, there's a few things. The first is to, I guess, the 3 Ws: wear your mask, wash your hands, and watch your distance.
Oh, I love
So
that. Yeah.
please remember those things. We want to definitely I think this is so. I think we've heard this a million times, but just wear a mask and wear it everywhere and wear it all the time. Please get used to wearing it. Even for myself, wearing it everywhere has been hard. Even when I go visit a friend, I have to wear the mask. Even when I
Mhm,
go inside his house and stay, even when I'm inside the house,
mhm,
I don't want to risk getting them sick, and I don't want them to get me sick either.
mhm,
Wear your mask everywhere you go, even if you are, um, you know, outside, but you're near people. Still wear your mask, and please watch your distance. Stay 6 feet apart wherever you go. If you have to go to the market, wait till the person just passes by you before you have to go near them. Um, and be more cognizant about washing your hands and carrying hand sanitizer with you. Just like, before you touch your face, after you go to the bathroom,
mhm.
before you prepare something to eat, just wash your hands so much. I would go to say is, as far as, try, Lysol wiping down things daily, like the doorknobs, the light switches, the surfaces you just touch a lot. You'd be surprised how quickly virus accumulates on those surfaces. And as for something else I think you mentioned is like, how do we stay safe? Not just virus wise, but mental health wise.
Mhm.
I think that we've seen a huge rise in people saying they have higher rates of depression, anxiety, and that's really, really tough because people are one of the best ways to stop the spread is just to stay home. Stay
Mhm.
home as much as you can. If you can have something delivered, have it delivered.
Mhm.
There's on the Rhode Island Department of Health, there's this thing called RI Delivers, and there's all kinds of things you can have delivered to your home. But with staying home, it also means that people are feeling more isolated, more
Right.
lonely, depressed. Those groups that people used to belong to are gone. Music groups, church, uh,
Mhm.
family gatherings, they're gone. There's definitely a lot of tips to try to like help you out. One of them is to definitely seek counseling, even if it's just to talk to somebody. BH Link, it's called Behavioral Health Link, is
Mhm.
a free service for anybody to talk to anyone, even if you just want to chat. There's also for substance abuse counseling. Um, if you think that maybe your substance use has increased during the pandemic, definitely you seek, maybe talking to someone about that. And there's also Kids Link, which is just like Beach Link, but it's for kids and teenagers. They don't need any type of permission necessarily to talk to anybody. It's kind of just like a very confidential kind of thing. And it's all virtual. It's all through phone or online. You can also go in person, but I recommend online, of course. Yeah, and we've
Yeah.
also seen, unfortunately, a rise in domestic violence
Mhm.
across the board. That's probably due to people having to stay home more and more strains on things like, more financial strain.
Yeah.
And there's also a lot of supports on the Department of Health website. Please take a look to see. There's tons of organizations that are helping people who are going through domestic violence.
Excellent, Alan. Well, thank you, because I do think that there is so many layers to this. It's a physical health issue, right?
Yeah.
COVID-19,
Hmm.
but then the layers or the impact really does spread. It impacts our mental health, it impacts our individual well-being, our family well-being, and
Yeah.
then it ultimately impacts our community's well-being. So those layers that we're seeing, you know,
Hmm.
for things that we were already struggling with. As you were
Right.
saying, I mean, we're about to see an increase in the issues related to housing, but we already know that we've had a housing crisis here in Rhode Island for several years. So that's
Yeah.
only kind of adding to that.
Yep.
And it brings up my next question, which is, we know that there's housing issues. And as you were saying, one of the biggest things people are looking for is food.
Mhm.
Where can people get supplies, whether it's cleaning supplies, whether it's food, whether it's resources? Do you have any, resources or information for people who are really in need of additional support?
Absolutely. Yeah. So when people are looking for resources, if they have access to the internet, the first
Mhm.
place I tell them to go to is the Rhode Island Department of Health. They have a mountain of resources. There's even like a little handy dandy flyer that they have on their first page. It shows a list of organizations that will deliver food to your home, prescription delivery, legal help, mental health counseling. Some housing assistance. So those are definitely the places where people would, first go to.
Yeah.
If you're not able to access the internet, I would most definitely say call 211 United
Okay.
Way.
Mhm.
They're really great at helping people over the phone. And they have a really great job of, being able to show you, hey, here's a food pantry or a list of food pantries that are in your area. That, sometimes they're even within walking distance. Here's where you can go to get, here's where you can get a DHS application, where you can
Mhm.
apply for things like SNAP or cash assistance. And then people at DHS are actually, some people are hired just to help you fill out that application. So which is great. So they have, and the numbers right on the application. And other resources, I definitely, tell them, of course, like BH Link, talk to people for counseling, and then they're really great at connecting you to other organizations that can help you out for lots of different things. So yeah, that's my first. Those two are my first go-tos.
Yeah.
That's awesome, Alan. And I love that, you're able to kind of share different ways that people can access those resources. And I also am so glad that you highlighted DHS and things like SNAP benefits, because I think so many people have been financially impacted who perhaps never thought of applying for assistance with things like SNAP benefits before, but that now might actually qualify for things like that. So
Yeah,
it's really
absolutely.
important for people to kind of think out of the box around those things.
Mm-hmm.
So one of the reasons that we had you on, and I think we're hearing more and more in the media, those, as you're stressing, those 3 W's and reminding people, to wear their mask and wash their hands and remain distance, this idea of that we've been doing this for so long that people, I think, are really getting maybe a little more casual, or just not. We're just all so sick of it. So one of the reasons we wanted to have you on today was to remind people and kind of going back to those basics. So I guess a question I have that it's good to remind people of: if someone thinks that they've been exposed to COVID-19, what should they do?
Okay, yeah, and then you bring up a really good point. And it's just like, it seems as the longer the pandemic goes on, the harder it is to stick to those rules, because we're just becoming so fatigued.
Yeah.
And we can't blame them. I mean, like we can't. There's a huge rise in people getting tested just so they can socialize.
Right.
And, I don't blame them. I mean, I have half of mine just to go get tested just so I can socialize. But we can't. But the first thing you should do if you find out you're positive is isolate. Immediately isolate. And what that means is to go home and only be in your room and use only one bathroom. And ideally, that would mean that you are alone in your room and you are the only person using that one bathroom. That's ideally how it is. We know that it's tougher for some families. We've heard of people, 8 or 9 people living in a 2-bedroom apartment,
right,
with 1.5 baths, and that it's really hard. But the first thing to do is isolate. Those people who live with that person who has tested positive will also have to quarantine. And what that means is that they have to stay home. That doesn't necessarily mean they have to isolate themselves. They don't have to just stay in their room or just use that one bathroom, but they do have to stay home. And that means everyone. And so that means no going to work, no going to school, no anything. I'm just going to go pick up some stuff from the supermarket. You're quarantined. You have to stay home. And I know that's tough, but that's when you have to really reach out to these resources, for things to get delivered to you. Try to have a friend or family member. If you really can't, there's of course those services you can pay for. But that's really, that's ideally you want to try to look for people who can support you, without having to pay.
Well, and Alan, if you haven't tested positive yet, but you've been exposed, you now have gotten confirmation that someone close to you has had coronavirus. Should you take the same steps of isolating, in one part of your house?
So if you find out that you've been exposed, the best thing to do is to quarantine. You will have to quarantine for 14 days, because we know that it can take about 14 days, up to 14 days before symptoms appear, if you're symptomatic. So that's the first thing you would need to do. And if you do test positive, the best thing to do is, after you isolate, is to call your primary care doctor and let them know about the diagnosis. And then they can, move forward the next steps to decide, what might be best. Most people do recover just by staying home. and doing the usual things, lots of liquids, taking care of themselves. But yeah, if you find out you've been exposed, you're gonna have to quarantine, which I know is tough too, but that means also for you, no going to school, no going to work.
Right.
Mhm.
Well, and I think that's so important because as we're seeing the numbers spike up, up, and up, right? Really following these guidelines is really the only way that we're going to get to a place where we're seeing
Yeah.
numbers go the opposite way,
Right,
right?
right.
And I think another thing that back in the spring, when we all kind of first were confronted with COVID-19 and this crisis, we heard a lot about washing our hands, right? So, and you mentioned that earlier. And, again, back to the basics, just to remind people, what can you kind of remind us what is the proper way that we should be
Mhm.
washing our hands during this time? And I know that
Yeah.
seems like a basic question, but I
Mhm.
think, it's important that we're reminded of it.
Absolutely, yeah. So you want to wash your hands for at least 20 seconds. There's a little trick. It's sing happy birthday to yourself twice. Just
Got
sing it
it.
in your head. That's how long it should take. Um, and ideally, you want to wash your hands with, it can be running warm or cold water. Make sure to get the soap and lather in between, turn off the water right after you get your hands wet, put on the soap, lather, try to push the soap in between the back and front of your hands. Try to get underneath your fingernails if you can. Try to like get through. Really pay attention to like washing every part of your hands, and then rinsing off for the other 10 seconds.
Got it.
Hmm.
Right. I think that happy birthday, I'm so glad you said that because I think people have now cut it down to like one happy birthday.
I know.
Two happy birthdays.
2 happy birthdays, yes. Do a service to yourself and just do it, And
Yeah.
a little trick, a lot of people say you don't like how dry their hands get right after washing their hands so much. Definitely right next to the soap, put a little thing of hand lotion.
Yeah.
Right after you wash your hands, put a little hand lotion and helps a lot.
Yeah. And those smells that we all really enjoy, right? Because smell can really be linked to our mood, right?
Yeah.
It's such our smell gets linked to our feelings. So
Hmm.
finding, if you can find a moisturizer that, reminds you of something really nice or makes you feel really good, right?
Yeah.
Those little things can make a huge amount of
Mhm.
difference.
Oh,
If
that's
it's your
totally
hand
right.
sanitizer,
Yeah.
now's the time because Bath and Body Works is stocked, everyone. Now's the time to get your hand sanitizer,
Yeah,
but it smells
right.
really good.
Bath and Body Works delivers too, so I mean, no excuse.
I had no idea. Well, one final question that I have, Alan. We know that many children are still going into schools. We've all been talking about how challenging that might be. And do you have any tips to encourage children to wear their masks or to wash their hands? Kids
Mhm.
love touching things. They love
Oh
pulling up
my
their
goodness.
masks.
Yeah.
What are some ways that we can make it maybe fun, not
Mhm.
as scary as we're
Yeah,
moving through this?
yeah. Well, kids love YouTube. They live for
Oh, that's
YouTube.
true.
They live for the iPads, and one of the first things I would tell parents is like, there's a million videos on YouTube explaining a lot of these things about viruses and bacteria and bugs, and so there's plenty of videos on YouTube. You can just Google, explaining COVID to my kid.
Mhm.
And there's like these cute little animations, little videos that will sit there and explain to you in an age appropriate way, kind of telling them like what the virus is, what it does, and why it's important for everyone to wear a mask and how we help each other out. So when we show those videos to the kids are more likely to actually pay attention
Mhm.
and follow through. The next thing you can kind of do is, help make a mask with your kids. Make it into a fun little project if you can. Help, have the child pick out a material that they actually like. Something that's soft, breathable. Um, Make sure that the mask is, snug. It's not like falling or too tight because then they're less likely to fidget with it. And let them, you kind of like decorate it. Let them, put on little stickers or things that they like on the masks. and in school, you know, we want to make sure that we supply schools with enough masks so that in case a student doesn't have one, the teacher is able to give them. Um, yeah. And yeah, so we kind of just want to explain to them why it's important so that you wear a mask so that your friends and your classmates don't get sick too.
Yeah. That's so important, Alan. And I think that I love the tip about making sure the mask fits correctly, because you're so right. Kids are way less likely to fidget with it if it's snug and it fits and it feels good. So I
Hmm.
think that's
Hmm.
something that's important to pay attention
Yeah.
to.
Hmm.
Um, is there anything else that you'd like to share with us, Alan, that we haven't talked about? The work you're doing is so important. And, we thought it was really important to kind of revisit this topic about COVID and how we
Yeah.
can all do our part. Is there
Hmm.
anything else that you want to share with us that we haven't asked you?
Well, I guess there is a recent development.
Yeah.
Luckily, Rhode Island has been chosen as one of the first states to receive the vaccine
Yeah.
from Pfizer, which is really exciting. I mean, that must say something about what we're doing. You know, the cases are up in Rhode Island, but I mean, we're
Hmm.
doing a really good job of, trying our best. So
Yeah.
that's really fortunate that we will be one of the first states to receive the vaccine. I guess what I can say is, um, please, please, please get your flu shot. Please, please get tested. There are on the Rhode Island Department of Health and through United Way, you can find out where there's a testing center. Um, and you can some of them require a doctor's authorization, others don't. Some of them are
Okay.
rapid testing, some of them are not.
Okay.
um, but first, if you want to get tested, first contact your primary care doctor. There they can help you navigate where to get the test, and a lot of medical practices are able to test you right on their site, which is really convenient. So definitely try to get tested. The Department of Health really, really wants to push getting tested within the next 6 weeks. You knowing your status helps so much,
Got it.
and definitely get your flu shot. I mean, I can't imagine. We do know that you can get both the flu and COVID. I hate to scare people, but you
Right.
can. But getting the flu shot helps strengthen your antibodies, and less likely to catch the flu and, not get more complications from COVID. So that's really important. And when the vaccine comes out, please go get vaccinated.
Yeah.
Please get vaccinated. It's our, and just because you get vaccinated, don't stop wearing the mask. We're just
Right.
going to keep doing
That's so important. And I think, Alan, too, for those people that may not have a primary care physician, they can call urgent care. Can they call urgent care centers? Is that what they should do? I think that's yeah.
They can, if they don't
Okay.
have health insurance.
Yeah.
There is a couple clinics
Okay.
that are completely for free. There's
Okay.
called Hope Clinic or Clínica Esperanza
Okay.
in Providence that's free for adults, and then the Rhode Island Free Clinic
Great.
in South Providence that's free for anybody. Doesn't matter your legal status, doesn't matter your insurance status, your medical conditions. It's all free, and they are an excellent resource to help you point you in the right way,
Great.
right direction.
Awesome.
And if you don't have health insurance, I mean, Medicaid is accepting people across the board. Medicaid luckily is accepting everyone, depending on, of course, if you qualify. If you qualify,
Mhm.
Medicaid has been a lot more lenient about what they're covering. So definitely look into getting that.
Great.
Mhm.
And Alan, we will make sure that right after this that we post some information for people who do live in the 02905,
Yeah.
how to get in contact with your program if they're in need of assistance. So, you
Absolutely.
know, I want to just say thank you. It's been so informative having you on. I think it's such a reminder of, it's not big things. It's those little things that are going to help us keep safe and help our communities really, strive or thrive as we're going through this pandemic. So thank you so much for being on and for all of this information. We're so lucky to have you here at
Oh, thank
FSRI.
you.
Thank you.
Yeah, no, I'm really happy to share. Thank you so much for doing this and for me giving me the opportunity to share all this information. We really just want everybody to be safe and to be healthy.
Yeah, well, thank you. And thank you everyone for watching. Again, remember, if you're in need of assistance or you know someone who's in need of assistance, please don't hesitate to call our intake department. And be well and be safe.
Thanks. Bye, everyone.
Thank you.